Hey everyone, Suzanne here with caregiverhaven.com. And today we're going to talk about the 9 quiet signs of decline and when to speak up. It's about having that serious conversation. As far as I'm concerned, it's never too soon, but for many of us, we just dread it. And we just wish that somebody else would come in and do it for us, which, by the way, I have done many times for families, for my clients who wanted this done. But I have also had to hire someone to come in and do it for my own family members because I was just too close to it. So it's a difficult situation. There's a lot of decisions to be made, and there is no right way or wrong way to approach this conversation. So let's go ahead and look at when it is time to speak up. Okay, there are actually 9 warning signs that it's time. And you would be surprised at how receptive the aging parent is to some of these, but not others. What you think is important to them is not important to them. It's always a shocker for me when I do go in and start these conversations to see what's important. And when we lay out what the adult child says versus what the senior says, it is often two different things. Also note that these conversations do not one conversation does not solve everything. This is going to be a series of conversations you are going to have. It may take a week, it may take 12 months, it may take 2 or 3 years, but it's a conversation that keeps being injected into the visits that you have with your aging parent, the concerns that you have. You're going to do it. You're going to find the right times to do it, but it's an ongoing conversation. There's just not one of them. Okay, so let's make this a little easier. First of all, we're not judging someone, okay, for having a bad day. Everybody has bad days. Everybody's house gets messy at times and things like this. We all have those. What we want to look at are patterns, something that keeps happening or gets worse. Here's the quick test that you want to do. Has it happened more than once in the last 30 or 60 days? That's a repeat. Okay, now we're starting to see things repeating over and over. Is it new or unusual for them? So, have you not seen this behavior? Have you not seen the house a mess? Have you not seen no food in the refrigerator when there always was before? The next question is, does it affect safety, money, or health? Money is extremely important. We're going to talk about that later. And is it starting to limit their life? Like, are they not leaving their house? Are they missing care? Are they not going to the doctor? Or they're losing strength? When you notice this pattern, are they losing weight? That's a big one too, because when they lose weight, an aging parent will often lose muscle mass, and it's extremely important that they keep their muscles. So, have we noticed a pattern? That is your sign to start the talks, not one big sit down talk, as I said. This is going to be a process, and starting it earlier makes it calmer and makes it more successful. So, we'll talk about more of this later on. Okay, let's look at the social signs. There's social and physical signs. Let's look at the social signs first. Social connection. This means that they are no longer going out. All right. When someone stops calling friends, they're going to cancel plans, or they sit in front of the TV all day long watching the news or whatever. It's going to, it can be the isolation and the depression. And this is a major change. Isolation makes everything worse. We know it makes memory worse. We know motivation is worse. Hygiene gets worse, eating and even walking. All of this starts to deteriorate when this person is sitting in front of a TV or just not getting out anymore. They're not getting up, doing things around the house, which, if they are doing things around the house would look better, right? When it's not looking better, what's happening? They're sitting down. So watch for things like fewer outings, less interest in people, avoiding phone calls or text messages, or saying, I'm just tired. How about another day? This isn't about being busy. It's about somebody slowly disappearing from their own life. And it is happening repeatedly. Then it's time to start the talks because isolation can become a fast slide. I've seen it slide horribly fast, like within a month. The thing is, these conversations you're going to have are preparing them for the future. It's securing their wishes now, financially and healthfully. What are their wishes as if things start to get worse? It doesn't mean they are, it just means preparation. A lot of people think, oh, you're thinking I'm going to die. No, I'm thinking we're going to prepare. Totally two different things. Social sign number 2 is the mental engagement. Are they keeping mentally engaged? And that doesn't mean doing crossword puzzles all day. It means the brain is still curious and active. It's reading, it's learning, it's talking, planning, following stories, handling daily steps. A warning sign is when someone stops doing the things that kept their mind sharp, or they struggle with routines they used to handle. They can't do them anymore. And you begin to notice that they can't follow a TV plot. They give up on hobbies. They don't want to try anything new. That crossword puzzle book you bought them for the holidays or for a special event, they haven't even opened. The puzzle is sitting there. Nobody's putting the pieces in. They don't want to try anything new, and they seem more confused when there's a change. This can be stress, depression, a medication side effect, which we've talked about 1,000 times, these medications, or early cognitive decline. The point is, if it's new and repeating, start the talks. Let's prepare. Let's start preparing for the future. Okay, what's it going to look like? And again, what their wishes are. Home environment, I mentioned this, is one of the clearest clues because if it's a messy home, that means they're not getting up, they're not moving around, they're not cleaning their home. Watch for clutter that blocks the walkways, the dim lighting, the loose rugs, the piles of mail, the spoiled food, or a kitchen that looks unused. Sometimes and oftentimes it is physical pain, and they literally cannot pick up the things on the floor that they drop. They just can't do it anymore. Sometimes it's a vision change and they can't see it, so they don't know it's occurring. And sometimes it's memory or low mood. But the risk, whatever it is, it's real. It's going to cause falls, infection, pests, and missed bills. But most importantly, it's time to start a conversation about either moving, that's a difficult conversation, preparing the will, a difficult conversation, or the health directive, a living will. Who is going to do what? What are your wishes? All right. Don't wait for the fall. Don't wait for the stroke. Many times, if people fall, they think they're okay, but I will tell you, they've hit their head. If they've hit their head, a signal is they might not be able to function anymore. So, a big secret here is to look at the trash can and the refrigerator, and that's really going to tell you what's happening. All right, what about transportation? It is more than just about driving. It's about staying connected to life. All right. Transporting us out of the home means we have doctor visits, we get the groceries, we have friends, we have a community. A big warning sign is when transportation starts shrinking. There's missed appointments and fewer outings, especially when they say, I don't feel like going, or suddenly needing rides they used to handle. If they're still driving, watch for new dents in the car, getting lost, close calls, driving short, they're not driving, they're in an RV and they've driven around the country all these years and now they're not even driving out of their own state. Okay? If they've stopped driving, you have to start watching for these isolation and these really skipped care. Are they not going to their appointments? Transportation problems are going to snowball fast because once someone can't reliably get places, everything else starts to fall apart. Next thing is financial. Financial trouble is going to happen fast, and it happens faster than a fall. Watch for unusual purchases, giving money away, donations, subscriptions they don't remember, signing up for, piles of unopened bills, and also watch for repeated purchases. I've seen this 100 times where they buy something and they buy it again and again and again. Next thing you know, they have 30 cases of light bulbs. They have 30 diapers or adult diapers. They have all this stuff they've bought and bought and bought. Extension cords, they love extension cords. This isn't about being bad with money. It can be scams, loneliness, confusion, or brain change. And now I'm going to bring up something really quickly here. If you are somebody who is an adult child who lives out of town from your parent, phone calls do not cut it. I have a a paper, that a document that goes with this, a PDF, that explains a story in there that you really need to know, because I've seen these things go on over and over and over again in my practice. Neighbors are not always neighborly. You think that, oh, my niece is going to take care of them, or I have a cousin down there that's going to take care of them where he lives or she lives, or the neighbor is watching. Oh, no, 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 no. I can tell you from living in Florida and practicing medicine in Florida that it is one of the biggest scams we have. That neighbor moves in, that neighbor steals everything from the house, including your mom or your mom's jewelry or your dad's watches and money, and it's gone. Nobody is watching. So being far away, you need to pay attention to this webinar. You need to get down there to where your aging parent lives, and you need to see them. You need to spend time with them, because this is going to raise your radar. Okay, next thing we're going to talk about is physical signs, physical activity. Because, they can talk to you on the phone. That doesn't mean anything. You've got to see what they're doing. And one of the best predictors of future independence is how they're getting around. They don't exercise. And when they're moving, it's less. And they say it's painful. Well, if it's painful, either figure out what the pain is, get them to the right doctor, figure out what the pain is being caused from, or get them into physical therapy, or get them some relief from the pain. Okay. They're walking shorter distances, avoiding stairs. They're needing more help getting up. They can't get down. They need grab bars, all of this stuff. This is one of the clearest times to start the talks, because it's a change you can spot early. Notice how they stand up from a chair. Are they using their hands? Are they wobbly? Can they not even walk 6 steps because their back hurts? And then look at their nutrition and their hydration. Are they actually drinking water throughout the day? Are they eating? Can they still get what they need? Is their refrigerator empty, or is their pantry full of garbage food, what I call those trashy chips and stuff like that? Or are they eating real food? Watch for weight loss, looser clothes, low energy, constipation, dizziness, dry mouth, or a refrigerator that looks like this. Many seniors drift into tea and toast meals. What that means is it's easy, it has no protein, not enough fluids, and dehydration alone can cause confusion and weakness, falls, and hospitalizations. So if you see any kind of weight loss that's not intentional, that is not aging. That's a signal. You're going to have to start looking at these talks, and you're going to have to reverse that weight loss and that muscle loss. The next thing is medications. Are their medications all mixed up? Oh, I've seen this too. And the fastest way a stable person becomes unstable is their medications. Watch for missed doses, double doses, bottles scattered, expired meds still being used. How many times have I seen somebody go off their Eliquis, or they go off their, blood thinner, and the next thing you know, they've got a clot and a stroke because they were confused about their medications. So, is it time for medication management? If it is, you get somebody in there to manage their medications for them if you can't do it. And you have this talk that it is time for us to look at what we have to put in place to secure your wishes are being followed if something should happen, because medication management is going to lead to strokes and falls, dizziness, hospitalization, and ER visits. Another thing is if they're missing doctor appointments. It's bad enough that physicians can no longer see you within a week. It takes months and months to get into the doctor's office. That's the system we have today. So are they rescheduling? Are they refusing to show up, which means it's another 6 months before they get in? Sometimes it's transportation, it's fear, it's confusion, but they must follow up with their doctor. They must be getting in to have the appointment, do their labs, do any imaging studies that need to be done so the doctor can figure out what's wrong with the blood pressure, the diabetes, the heart issues, infections, vision, hearing, and pain. All of this has to be taken care of. And this is where caregivers get blindsided because they assume the healthcare is being handled and it's not. More and more, our healthcare system is being squeezed into do more, see more, and do less for the patient. They want to see more patients and do less for each patient. And so the patient is not being tended to. And this is why patient advocacy is one of the largest professions and fastest growing professions in the United States today, because seniors do not want to be left alone anymore. They want somebody to speak up for them. It's extremely important that we look at that. So these are the things that we've looked at. Um, and they go into the doctor and they say they're fine. That's another whole thing, which we often know they're not. So what we learned is it's going to be okay if you have these conversations. And these are not bad conversations to have. This does not mean that you're never going to speak to your loved one, your aging parent again. You will, but you do have to look for these signs. Grab that PDF that I have for you. It goes over all of this again for you. And it's an assessment where you're going to check off where your aging parent is on each and every one of these. Are they okay on the social venue? Are they okay on the physical venue? Or are there some real warning signs right now that say, you know what, we've got to start the preparation conversations, because we never know what's going to happen. And I will tell you from being a senior myself that yes, my friends are getting older. My friends are having strokes. They're having hip replacements, knee replacements, shoulder replacements. They're not walking as far as they used to. They're getting walkers. They're walking on canes. Some of them are losing weight. All of these things their children should be looking at and saying, hey, we need to start in preparation. And a lot of my senior friends say, oh, I've got a lawyer and the will and it's all taken care of. It is more than that. It is making sure they get their appointments. It is making sure they're not waiting. It is making sure that they're getting out and getting the nutrition they need. They're getting the socialization they need. They're getting the exercise that they need. They're not staying in front of the TV all day long. All of these things you don't see as an adult child, but I see it because I am in the senior community. I am in medicine, and I have friends that I'm watching go downhill, and their adult children are not having these conversations. So this is what I'm saying. You need to pay attention. Okay, that's it for today. And I hope I've given you some food for thought, and we'll see you in the next video. Take care.